Hi all, this video is supposed to help you find a structure to think through your medical specialty selection, or just sort of start pondering of where you want to take your career in your life if you are in medical school or just out of medical school, or you're considering going for it. In terms of where I'm coming from, I am a general practitioner. I have more of a portfolio career approach to my practice, so I have a very small practice and I do other things to diversify what I do day to day. How do you conceptualize what you want to do? This is an approach that is semi-structured, but obviously it's not going to fit everyone. I'm just encouraging you to try and apply some kind of a system to your selection process. Now, once you start doing rotations, you're going to have a much better idea of where you want to take this, and what is the right fit. There is a particular personality profile in different specialties, and basically, if you're going to fit that type of a profile, it becomes pretty evident for people who saw a lot of students through where they're going to end up potentially, or where would be a good fit for them. Talking about just preferences of how you work, where you work, who do you work with, in terms of colleagues, in terms of environment, in terms of patients. So when you're just starting to conceptualize what to do with yourself and with your time, the best place to start is to figure out if you want to do some kind of a surgical stream or some kind of a non-surgical stream, medical stream. So deciding that pretty early on can be helpful to weed out and tease out like really specifically what you want to do, and what might be a good fit. A lot of the time you're going to like both. So first and foremost, are you surgical or are you medical? Do you like interacting with people mostly for a definitive fix where you have a problem, you can fix it, that's that? Or do you like a longitudinal approach? Do you like getting to know people personally? Do you like to see them over and over again over time? It'll determine where you would fit in best. If you like a lot of interaction, if you like person-to-person contact over a long period of time, and if you like more lengthily digging into a person's life history and medical problems to like really figure out how you can help them, medical stream is going to be better for you. That is a huge diversity of careers, so don't worry, you'll find something that fits. If you are somebody who likes working with their hands, if you are somebody who likes a definitive fix, meaning that, okay, here's a problem, I can surgically fix it or I can't surgically fix it. If you like that dichotomy, I think a surgical specialty is going to be probably a better choice. People who are medically inclined and end up in surgery just end up really disliking their schedule and timeline, and not feeling satisfied with the interactions that they have with their patients. And people who are meant to do surgery who end up in a medical career just get very bored with what's going on and annoyed at how long everything takes, and also annoyed at lack of results. So if you're surgically inclined, then you have a variety of different surgical specialties to choose from. Some of them are mixed clinical and surgical. Some of them lean heavily towards just surgical. So there's a lot you can choose from. There are systems that you can choose from, compensation models, requirement and need, like how many cardiac surgeons or thoracic surgeons do we really need? Where are the spots for them? So it will be pretty intuitive to you and pretty apparent to you which stream do you belong in. We'll go through some surgical and some medical subspecialties and specialties in the future, but that would be the first step to decide which one do you belong to, most likely. The third category is going to be a little bit more specific. Those are the people who just really don't love working with people, just want something specific that they can do, analyze, and hand over. So that's going to be lab medicine, that's going to be medical genetics to a degree, that's going to be radiology, that's going to be pathology, so where you work more with other medical practitioners rather than patients. That tends to be appealing for people who just get annoyed with complaining. If you're in medicine, it doesn't mean that you have to love listening to people complain about their problems. That's a specific type of a personality tolerates and does well with that and problem solves around that. Don't feel bad if you just don't fit into that category. Look at subspecialties or specialties that do not require a lot of patient interaction, and that will make you a lot happier, and it'll make you stay within medicine and do well within medicine. As opposed to, if you're the type of person who just does not like interacting with people, but you're not particularly loving working with your hands either, then you probably need something where you're working with objects, things, images, slides, and communicating with other practitioners who are going to understand you. If you are annoyed by compliance issues, that probably is the stream that you want to head towards. Now, there is some crossover. For example, you can be an interventionist within radiology and or pain management within anesthesiology. So there's a lot of complexity and variability even within each field. If you want to go surgical, you want to think about what kind of surgery do you want to do. Are you doing surgery within the operating room environment, big surgeries with general anesthesia? Is that what you like? So versus, do you want to do small procedures and mostly office-based? For example, a lot of dermatologists, they would just do small office-based procedures, which is very satisfying. How much variety do you want in your day? Is going to be a good question to ask yourself. Do you want it to be pretty variable, or do you want it to be pretty steady? When we're talking about the medical side of things, there's so much you can do. Biggest things to consider is, do you want to do family medicine or something within internal medicine? And its subspecialties. If you want to see a great variety of things and do a lot of things but not very deeply, you want to do a shorter residency, you want to have a lot of pivot room, and you want to be employable anywhere, general practice is the way to go, because in that case you have a lot of wiggle room as to what you want to do with your career. You absolutely do not have to be 100% general practitioner and just see sniffly noses all day. That is not what this is going to be necessarily. Depending on how you play it, you can have a lot of flexibility with family medicine. So family medicine is a good choice for those of you who want wiggle room and a shorter residency, a more tolerable residency. If you want to go for GIM, that is a specific type of personality, very grueling hours, and a lot of difficult cases. If you want to then further subspecialize, there are subspecialties with better lifestyle and worse lifestyles. For example, oncology is a pretty tough gig. I would say lots of burnout for sure in medical oncology, versus something like allergy and immunology tends to have a better time schedule and sort of a better lifestyle to go with it in most cases. And nothing I'm saying is going to apply 100% of the time, but in general, it does. So you then would select, if you're going through general internal medicine, you have time to select what kind of subspecialty you'd be most interested in. So you don't have to make that decision immediately. It will become apparent through your residency what to do with that. So general internal and subspecialties is going to be for those of you who like to really sink your teeth into cases, more complicated cases, or multifactorial, not easily treatable cases. That's going to be where you're going to land. If you like any particular system that you want to work with, nephrology, hematology, cardiology, you can really hone your skills in that area, and you can be dealing with that particular system. If you want a lot more zoomed out perspective on the patient, then family medicine is probably going to be a good choice, and also depending on what kind of lifestyle you want. Now, within family medicine, you can more easily compose a portfolio career. That's what I'm going for. Within internal medicine and subspecialties, you can certainly do a lot of contract work as well, but your opportunities are going to be a little bit more limited, mostly because you probably will have commitments with hospitals that you need to fulfill, and the timeline is just going to be very squeezed already, because if you're working within the hospital system, and if you're a specialist, you probably are, at least within Canada, you're going to be signing contracts for a specific number of hours or shifts covered, and specific call schedules, so your time will be more likely spoken for, which is great because most likely you're salaried or fee-for-service, but you will have a lot of stability in terms of your income and in terms of your schedule. In terms of emergency medicine, a lot of people like emergency medicine because it's in and out, it's shift-based. You can choose the number of shifts you do. It's a little bit more high stress, but also better paid than general practitioners would get. There are several ways you can get into emergency medicine right now. It's pretty easy to find, at least in the area where I practice, to find emergency medicine positions. But with emergency medicine side of things, you do retain some of the flexibility. You do see higher acuity. Another thing to note is that pivot room within emergency medicine is actually pretty good, and you can get there through a couple of different pathways. You can get there through general internal with emergency, with emergency specialization. That's going to qualify you to work in tertiary centers. It's going to also qualify you to work some ICUs and stuff like that. So depending on how you feel about that and how important that is for you. You can also get into emergency medicine relatively easily with a general practitioner specialization with added competency of an extra year or two of emergency medicine, depending on which program you're going for. So you can get there through internal, you can get there through general, and in both cases, you're going to have some flexibility in how you're going to practice. Alternatively, you can also do all the same things except work in the telehealth side of things. That's going to become more and more prevalent. You can do combined practice where you do some telehealth, some in-person visits or walk-ins or whatever you want to do. So I think this kind of gives you a bit of an outline, very, very general sketch outline with a few details of how you might start to conceptualize which stream you want to enter or you want to consider trying, at least during your rotations. In future videos, I'm looking to zoom in onto lifestyle. We're going to talk about lifestyle specialties and also different lifestyles within different specialties. There's a variation there for sure. We're going to talk about remuneration. That's going to differ based on which location you're practicing in and what kind of practice you have. We're going to zoom in on that. We are going to focus on family medicine versus non-family medicine medical careers and what you can do with either of those. We're going to talk about added competency training within family medicine because that is the environment that I come from and I spend most of my time with, and I hope that is going to be useful as well. So there's a lot to cover. Let's go back and review what we've covered today. What we've covered today is the conceptualization of your understanding of where you might find a place for yourself in medicine. Firstly, figuring out whether you are going to be medical or surgical. Then we talked about the subgroup of radiology, pathology, lab medicine, medical genetics, that stuff that is going to be a little bit less patient-centric, a little bit more system-centric. And we're going to return to that and go into more detail of what that might look like. And then we talked about the medical side of things, which includes either general practice or medical specialties and subspecialties, and what that might look like. We will go into a little bit more detail in the future, sink our teeth a little bit more into the details of that kind of a lifestyle. And so you can have a better idea of deciding on what might fit you better. In the future, I also want to cover some of the non-clinical options because that is somewhere where I spent a lot of time. And we are going to cover the idea of a portfolio career versus a straight up medical career, and what options are out there within the clinical medicine to try and fit it to what you want it to look like. So don't feel like you're trapped. Don't feel like what you're seeing on your rotations is the only thing that's out there, because it is not. And do try to understand and wrap your mind around the different options that you have. Because, you know, residency is a big time investment, a huge investment in energy, and a personal sacrifice in many ways. So making sure that you're in the right spot and making the best of what you have and to get you to where you want to go is going to be like really the focus of the next couple of years of your life. So hopefully the channel is going to be able to help you a little bit with that. That's it for today. Have a good day. take care of yourselves and stay well. And make sure, especially right now, that you are prioritizing your own health and well-being, and take care of that first, and everything else will follow. I'll talk to you later. Bye-bye.